morning, everyone, and welcome to the second day of the Global Pandemic Preparedness Summit 2024. Um cordial bom dia a todos. Sejam muito bem-vindos a este segundo dia do GPPS 2024. With all of you here, we are certain to have as fruitful a day as we had yesterday, and of course, we are expecting you to be just as impressive today. Temos certeza com todos vocês aqui, teremos hoje um dia tão proveitoso e agradável quanto tivemos ontem. With that being said, we'll start today with a keynote presentation exploring how climate change is heightening epidemic and pandemic risk. This will be followed by a panel session examining the varied drivers of emerging infectious diseases. That panel will be moderated by Chief Scientific Writer for CEPI, Kate Callan, also the author for the book Disease Acts. But before her, we will have Professor de Oliveira. He's the director of CERI, the Center for Epidemic Response and Innovation, and founder of CRISP, the KZN Research Innovation and Sequencing Platform. His work has explored how climate change impacts the spread of infectious diseases and considers a range of approaches and solutions. So, por favor, seja muito bem-vindo, professor Túlio de Oliveira. É uma grande satisfação recebê-lo em nosso evento.
Primeiro, só para...
First of all, I'd like to thank the invitation to be here in Brazil. It's just great to come back to Brazil. And what you will be seeing in the presentation, that I still work with Brazil, though I have left about 20 years ago. At least I visit Brazil twice per year to continue our work and now associated with climate change. I will provide the presentation in English, and that was requested, and the work was done in English. And even the people will joke and say that I am people joked when people do the wrong translation.
I'm going to change to English now. It's really how epidemics are amplified by climate change, and more important, how we can respond to that. So my presentation will have around 25 minutes, but I'm going to be bringing you three main important aspects, or three main points. First was debated a lot that we believe that we are more prepared to respond to epidemics. I'm not very convinced about that, but one thing that I am very convinced that the day zero that we need to develop vaccines, diagnostics, and therapeutics start with a genome. And that's very important to invest more in genomic surveillance. The second point that I'm going to highlight in my presentation is that you have to do that where close of the epidemics are happening. So strong collaboration, strong response is very important. And the third point is that, unfortunately, as we destroy our planet with climate change, and with rapid urbanization, we can expect a lot of epidemics. So the title of the presentation will be Climate Amplified Disease and Epidemics, or short for Climade, which is a program that we put together. But before I start, let's just show how that all started. So in South Africa, one thing that we did during the pandemic is manage to work together. We managed to work together. We set up a network for genomic surveillance. In the first month of the pandemic, we put like 9 universities to work together, and all of them with a green box next to it. That's a laboratory of the government, And that was fully funded by our own government, by the Science and Innovation and the Medical Research Council, And then once we discovered the first variant, what was the beta, we had another large investment from the government, to expand from genomics, but also to add virology, immunology, clinical trials, epidemiological modeling, where I helped to coordinate over 500 scientists to respond very quick. So once we identify anything new, we can do the clinical trial programs, we can evaluate vaccines. And that was quite successful. And that allowed us to then compete with 41 countries in the world to win the mRNA hub, just showing that when we work together, you can go from genomics to basic science to now start having a one full solution to development of vaccines in a country that has not done before. During the pandemic and after, we also had massive investment from our own universities and institutes. So, for example, in the last year of the pandemic, we launched a very large biomedical and genomics facility in Africa, very large investment. It takes 1,000 scientists working together. And in the top floor, in the 50th floor, we have 12 BSL-3 labs, really allowing to go from samples to genomics to then functional assays. What we also did, what's the objectives, is that samples stay in Africa and data is produced in Africa. But for that, we also set up a very large biorepository just to treat the samples with the utmost respect, that they can be stored properly, but can be also quickly accepted in a full robotic system, that as we identify something new, we can go back to the sample collections, yeah? But that we found that's not enough to get good labs, yeah? To get access to technology, we also have to attract people. So what we did, yeah, we also set up another campus, yeah, that it is CERI in Stellenbosch University, a very beautiful town. We have over 200 wineries around us, yeah, in a place that people want to come and stay. Like, so one of the groups that we convinced to move there, part of the program, is the Nobel Symposiums, yeah. So now they are running half of the Nobel Symposiums in Stellenbosch, yeah, just because just is a nice place to go so we can start attract talent, because talent is everything. And I invite you and SEPI to do the next summit there, yeah? But then what we thought, if we got this big investment in South Africa, that would be our duty and our moral compass to share that with the rest of Africa. So we work very close with the Africa CDC and the WHO Afro, and I saw the Director General here yesterday, John Kaseya. We also have the lab, head of the laboratory programs, Dr. Ieno Tabete, to set up a system in Africa that we could coordinate the genomic surveillance for COVID, which now it is expanded for pathogens. So what we did in our lab, CRISP and CERI, they are one of 4 specialized genomics facilities with a continental mandate. We produced data for 24 African countries and trained many more, which I will bring, yeah. But what we did, we tried to do something different that normally is done in the global north. Not just people send the samples and get data, but work together in a holistic approach, that protocols are shared, data sets, all the analysis scripts and training. And we end up with these fantastic results for the first time, to the best of my knowledge, of like papers with hundreds and hundreds of African collaborators working together and sharing all the resources. And that gives rise to a well-trained number of individuals, which then were followed, yeah, by a number of international large workshops. And these workshops, now they move around the world. This one that's in the 28th edition. And next week, in partnership with the Fiocruz, the Ministério da Saúde, we are hosting that in Brasilia, where we are bringing people from 60 global countries, which will be trained in very advanced bioinformatics analysis of the data. So that's what we like to do, is to give back to the community, yeah, in a way that we can train them. But then what we do as part of the Climade program is that if they identify an outbreak, we will ship them reagents so they can generate, yeah. And so that's how we're building this program. We built that on 2022, pivot from COVID. I promise my group do not want to hear the word COVID or SARS-CoV-2 anymore. We got death threats. We close our countries. We cause all kind of troubles. But then what we decided to do is then to bring a transdisciplinary data generation and different levels, not only genomic data, but epidemiology, human mobility, climate, human population, and vector, to try to understand and respond to the epidemics. But then we created this consortium with the big vision to generate the knowledge, to develop the tools and interventions, to control, predict, track, and control disease amplified by climate change, really to try to stop the spread of epidemics and avoid pandemics. And this is a consortium that's led by the Global South in collaboration with the Global North, So why we decided to create that? Because you may be aware that like large number of pathogens are being amplified by climate change. It's estimated that 50–80% of the non-pathogens are being amplified by climate change, including viruses and bacteria. And the viruses, we are talking about avian influenza. We have a big spread. Birds are flying much far away, and we had a great session yesterday. We are talking about arbovirus, about chikungunya, about dengue, about Crimean Congo hemorrhagic fever, and that's what we focus. So let me give you a few examples what we did. So we went back to our fellows. We have fellows. We trained 547 fellows in 48 African countries. And when they identify the first signs of epidemic, we send them protocols, reagents, and we guide them to respond that. We have a dozen of examples. Of course, I'm not going to take you to all of them, all done in the last couple of years. What I'm going to take you quick is to what we did from Rift Valley fever to try to create an end-to-end development of vaccine, and what we describe of the biggest outbreak of dengue in Ethiopia. But that also includes multiple outbreaks of cholera, a new strain of chikungunya that leaves the Sylvatic. But let's give the example on Rift Valley fever. Rift Valley fever is one of the key pathogens from CEPI. It has pandemic potential. It's a pathogen that under normal circumstance, would live in the interepisodic cycle that under normal rains, is just within the environment and infecting mosquitoes. But when you have heavy rains and flooding, which is getting very common, you can have emergence of infected mosquitoes that will first infect livestock. And we are talking about cows, we are talking about goats, and that's where the first human transmissions happen. And that can enter an amplification cycle to be transmitted between infected humans via mosquitoes, which can create a large outbreak. Very high case fatality rate, So what we did is to work with the top livestock institute in Africa, ILRI at Kenya, to first develop a system to sequence Rift Valley fever at high throughput and analyze that, And that's what we did. So we generate the system. We produce a lot of hundreds of more genomes of Rift Valleys. We around multiple African countries, and then we create a classification systems that identify the main lineages that go from A to O. Why was that important? Because by identifying the main lineages, lineage C, lineage H, lineage K, we could feed all this information to the mRNA hub, to, for example, Petro, and the Afrigen, which then start developing very quick, a vaccine, And we are happy to say, I was talking to Petra yesterday, that she's getting good result in the first constructs of the vaccines, just showing that how genomics can go straight from that to vaccine design in South Africa. So I think that is a big, big development that we have achieved so far. Another thing that we did is to bring a lot of mathematical modeling and artificial intelligence to try to understand what's going to predict it, what's going to happen with Rift Valley outbreaks. And what we found that the main aspects that seem to be emergent Rift Valley is not only precipitation, but it is the effect on croplands, When you have when you have floods losing croplands, and then that human population live close to it and then spread to urban areas. So we are beginning to try to understand what is the characteristics that are associated with climate and human movement to this outbreak, So with the Africa CDC and the WHO Afro, what we did as part of the Africa PGI is to set up sequences in another 40 African countries. And then we thought that's a great opportunity to us to build in what is to describe large outbreaks that's happened. So I'm just going to give you the example what we did with dengue. Dengue in 2023 and 2024, we had large outbreaks, some of the bigger ones that we have seen, Burkina Faso and Ethiopia. And to both of them, we had fellows that we send reagents that describe that. What we find sometimes it's completely counterintuitive, so you can expect the unexpected. So for example, here's the epidemiology curve on Ethiopia, which the epidemic is starting around August and growing very fast to 25,000 cases detected a week, is one of the largest outbreaks. And here is a map of Ethiopia that the first thing that we do is to use large data sets to calculate where these outbreaks like to happen. So for example, in the red areas. But what we notice is that they are beginning to move potentially to the lowlands, which would be to the highlands, which would be quite worrying, So what we detect? We detect two large introductions of dengue 3, genotype 3, major clade B to Ethiopia. And to our surprise, the main big clade that was introduced there, it had basal sequence from Italy. So how is that possible? That Italian, Italian outbreak could fuel one in Africa. At the moment, we cannot reject the alternative hypothesis that was Ethiopian, that was in Italy. But when we put the data, the Italian genomes are really basal. And when you look at the epidemic curve in Italy, the epidemic happened in June, July, and August, which is before the Ethiopian, really highlighting the potential that now with global circulation of these pathogens and climate change, that we may even expect the opposite, an outbreak in the northern hemisphere, potentially fueling one in the south. And that's important information that we have to start to take in account because that was unexpected. So when we model where likely dengue transmission susceptibility is, and that is my team asking me not to embarrass myself to explain the mathematical formulas, it is that when we map that, it's quite clear that Africa has a high dengue transmission susceptibility, with potentially the west of Africa, with large risk of importation from South America. So when large outbreaks happen here, we should be aware. And the east with a high risk of importation from Asia, And then some of the countries with high risk of importation, like South Africa, has low transmission potential. So we are beginning to put all this information together that includes vector susceptibility, urbanization, and rains and weather to try to understand. But one thing that we're going to have to go, it is also starting modeling the chance that northern outbreaks can come there. So that changed a lot the parameter. So the Climade, as I mentioned to you, it is not only running Africa, it is a program that it is led at the moment by South Africa, by Brazil, and by Australia. And a lot of the activities in Brazil is done by the Fiocruz Foundation, by Luis Carlos Alcântara team, which has not only doing outbreaks, but a big passion for capacity building. So here in the map in South America is where his team with us have trained fellows. We have basic training all major South American and Latin American. We do that a lot close with Pajo, and I have Jairo Menezes here. But the dots, it's where we help LACEN. LACEN, it is the national labs to do local sequencing, yeah? And they have described in the same way that we are doing in Africa, multiple outbreaks, yeah? Dozens and dozens. I'm just gonna take you quick to two and finish my presentation, yeah? One was very surprising. It is what's happened in Paraguay, a neighboring country. Yeah, Paraguay here in the A graphic, I have the dates. Yeah, in the x-axis, I have the temperature. And in the end of 2023, yeah, it had the highest maximum temperature ever achieved, with kind of a linear increase. Yeah, and see what's happened with the epidemiological curve in panel C. Yeah. We had a small outbreak in 2022, and then all of a sudden this explosive outbreak happened. But look the number of deaths, yeah? Absolute unexpected. By that time, Paraguay had close to 95% of the deaths in South America. Yeah? Really showing how an outbreak can be fueled very quick, yeah? What was the cause of that? We believe that's not only the temperature. And again, our hypothesis was that was an introduction from Brazil, but surprisingly, that was not the case. That was a strain that caused the lineage that caused the outbreak in Paraguay of 2022, a small one that seemed to add a couple of mutations. We are not sure if that's what it caused, or maybe temperatures and a low immunity population that started causing massive outbreak. And not only that, yeah, Luis' team did all this work in Paraguay with the Paraguay Minister of Health and done that in record time, within weeks of having the outbreaks. And one thing that we see is these clusters of infections with multiple fatal cases, yeah, that's in red in the tree, yeah, many with neurological cases, and very sad neonatal cases that die. Very surprising. What helped to spread that was not only temperatures, but what we linked very strong is to high density settings. The outbreaks starting in Asunción and moving very quick and falling to big outbreaks in the denser settings. And why that? Because we know that urbanization, especially not controlled urbanizations, will have large number of Aedes aegypti mosquitoes. So that's to take in account. A lot of these outbreaks, when they happen, they're gonna happen in big urban settings and sometimes very unexpected. And I think that yesterday I saw a presentation from the Minister of Health of Brazil, 4 million cases this year in Brazil. So it's unfortunately being amplified, yeah. As we speak now, yeah, we, with the team of Luis and Climade, is really work around the clock to really understand what's happening with the new outbreak of Oropouche virus, yeah. So very surprising, that's a virus that normally live in the Amazon basin, yeah. And what we have find, it is that this virus, it is not only accumulate mutations by stepwise process, by much fast ways, such as recombinations. So in the x-axis there, we see the different segments, is very similar Rift Valley fever, has 3 segments, segment S, M, and L, and the large segment L with a high number of recombination breakpoints. But quite surprising, we knew that that is happening within the Amazon, but then large outbreaks that start to move into Minas Gerais, to Mato Grosso, to Bahia, and Santa Catarina. And I believe that this team also sequenced the 2 cases that die in Bahia, really highlighting, putting us in that position, similar as we were in Zika in Brazil. We have a new outbreak that unexpected, leave the natural environment and start causing, and what's the association with that? Yeah, this is really happening, most of this data, and going to be deposited hundreds of genomes, yeah, to then help to diagnostic vaccines and developing, yeah. Another thing that we find that's quite important, yeah, is to do that not only as a response, but to try to go and where is the source of the outbreaks. Then again, Climade and Luiz Alcântara team, we partner with the Marinha do Brasil, the Brazilian Army, to put a molecular lab inside boats that go up big rivers, And why we want to do that? Because we know that a lot of that is where it's going to be the source of the new outbreaks. So we want to be able to identify this virus before they spread widely, It is a lot of work, it is a lot of very courageous people that are going to the field, producing this data in real time, to try to identify what's the source of next epidemic and to associate that with different aspects that's related to climate change. So just to conclude, in addition to, sorry, I had one slide before the conclusion, So another thing that we did is also stop fighting with our Global North partners. Is that right, Chico? Despite they treat us like terribly. When you detect a new variant, they close our country, they hoard the vaccines, they don't give diagnostic, So, but then to really try to not only get this program as a Global South program, but to work together. Because one thing that we learned to this pandemic, is this discrimination, nationalism will not help to do it. So it's really time that we join force, between the Global North and the Global South, but with respect to the Global South, because we are the ones that are so used to deal with epidemics, and we are the ones that can help the world to protect pandemics, So to conclude, Climate first activity starting Africa and Latin America in the last 2 years is picking a lot of speed. We have described dozens and dozens of outbreaks in a true holistic process that data and capacity building is done where the outbreaks happening, and really sharing not only protocols, but shipping reagents, by sharing all the analysis script, by capacitating people, because that's where we need. We need a workforce that can react where outbreaks are happening, We really engaging with large number of technical, public health, and political level, And the response is really happening, but we are also engaged with the COP, We presenting the first day of the health in the climate change in the COP. We're organizing to go again, just because we have to marry different disciplines, not only to react, but to predict the next steps, Of course, all these need a lot of money, and I know that after this presentation, CEPI will be coming to talk to me to give $100 million, because that's how this program costs, But one important thing is that the way that we do is that any money invested here, it go back to all the partners in Africa in a most efficient way, And that's part of proper capacity building and shipping of reagents and protocols. And I look forward to the panel discussion, and if anyone more information, here is the websites. Thank you.
Thank you very much, Tulio. If you'd like to take a seat. And I'd also like to invite up onto the stage Professor Mauricio Barreto from Fiocruz, who is going to join us for this panel. Thank you, Tulio. So we have about 25 minutes or so of discussion, and we'd very much welcome questions from the audience. So get going on the Slido or Sligo or whatever it's called, and I should get those questions on the iPad later on. But I'd like to start by asking you, Professor Mauricio, when you saw this presentation from Tulio just now, was there anything kind of surprising or shocking in it, or do you feel that one of the things that Professor Tulio said was that we should now learn to expect the unexpected. Was there anything in there that you thought, gosh, that's shocking or surprising?
First, the surprise is to see so beautiful things done in South Africa and Brazil. This is really a fantastic, presentation that is based in a lot of good research that is done, especially in Africa and Latin America. Then I think this is the first point that I'd like to raise. Another thing that Julio stressed is connection. I think infectious disease is a very dynamic process, very quick and dynamic process. If there is no connection among all those involved in understand, in prevent, in act upon the epidemics, it's practically impossible to understand the process and to be effective on that. These, I think, are the major things that I'd like to say, and to say, wow, it's fantastic. But one point that I'd like to raise to Julio, I'm a more epidemiologist, work with data, and I'd like to ask it to Julio, how this system, to see, because you are a lot focused on the genomic world, on the micro world, and that is really very important, But there is another world that is the more real world, the clinical world, the detection of cases, and that this is important to complement your action. Then I'd like you to comment about that, because the challenge in this area, that is not your area of activity, but it must be one area that you think about, how you see the difficulty to connect this other world that is the clinical world, the clinics, the primary health care system, where the cases started, In general, the cases move to there, and they are seen in the first moment in these settings.
First, thanks so much for the kind words. It is, of course, it's fantastic to the Global South be working together to respond to epidemics. The question is a very important one. How do you link that to the clinical staff that will see the first cases and how they act? What we found that the best way to do that, it is first to also involve them in the design of the projects, and also when you do the first response, when you have the first results, that's who you have to communicate first. So for example, in this program that we got dozens and dozens of high impact papers, but the scientific publication was the last objective. The first objective is when we find something unusual, is to phone the health minister or the director general. I have my director general here, Amban Pillay. Normally they don't like to listen from me. Normally it's bad news. And in a way that you give back first to who is taking the decision, to the clinical staff, that you involve them in the interpretation, and that you make that as part of the response, not that as academic exercise. The academic exercise can come later. And what you find by doing that, you have the engagement, you have the trust, and the academic journals, the big ones, they want your papers because they like the impact. So in the end, by inverting the game and engage with the clinical staff and the Department of Health in the beginning, it pay off. And that's where a lot of the training come through. People like to be respected. They also like to get skills, not just being a provider of samples.
Yes, interesting point. And that we were talking earlier yesterday, actually, about how empowering it is when you give when you have that exchange of information with the people that have to make decisions, on the ground. And as you say, the sort of international publications and so on come later. I wanted to ask you, you've been working on and looking at the environmental factors that drive disease outbreaks and epidemics for many, many years now. And I wondered if you had to point to the single most powerful driver would that be climate change, a warming planet, or would it be other factors like urbanization and habitat change and human responses to those things, or is it very much a combination of all of those things?
Yeah. So I will pass after to Professor Barreto. I think that he's better to answer that questions than me. What we found from the data is that a combination with three main aspects. Yeah, the one is the climate change, which in the climate change there is two different reasons. One's the gradual increase of temperature, which will cause especially vectors to move up in altitude and north and south, but also extreme climate events that will fuel some outbreaks. Yeah. The second one, it is really poverty and not controlled urbanization. Yeah. Never yet. This is one of the big reasons why outbreaks are happening. And unfortunately, that was amplified during the COVID pandemic as more people leave the countryside to go to towns in sometimes not good conditions. Yeah. And sometimes they will carry animals with them also that will not live in normal things. So that's the second cause. And the third one is global mobility. Yeah. Global mobility really came very, very high. It's almost look that we are compensating for what we didn't do in the pandemic. Yeah. So, for example, this meeting, how many CO2 did develop? We have people here from all the world to come from 2 days in Brazil. Yeah. So it's this combination between climate, yeah, urbanization, migration, and also increase back on mobility. Yeah, but I'm sure that you can answer much better than me. Yeah.
Indeed,
No, I'd like to add, I fully agree with your points. And I'd like to say that the evidence on poverty, for example, there is a lot of evidence in Brazil, in my group and the other groups in Brazil, how important is some policies like poverty reduction policies, like the cash transfer programs, in reduction, of poverty, but also reduction, of the chance of disease, on really have a huge impact, in the process of transmission of a lot of different diseases. And in some other diseases, a lot linked with the urban structure. The urban, the way that urbanization developed in Latin America, in different centers in Latin America, are very much create condition, to transmission of Aedes aegypti and the other kinds of transmitters that can speed the transmission of the disease. And no doubt that the climate change is an addition to this complex that you have in the recent years, that is aggravating in recent years, that as all the problems are not completely solved, the climate change is amplifying effects that already exist, like poverty, poor urbanization, and the other things that are in the base of transmission of different infections, and create condition to outbreaks and the epidemics or pandemics eventually.
But just to add one thing that we also have to remember with climate change, is that viruses, they don't only travel in airplanes, they also travel in birds, and they are traveling much further, because some of the regions are getting more warmer, or colder, and they have to move away. And we're getting this interaction that climate change is also increasing the interaction between different animal species that would not happen. And I think that you are very aware, and Rick Bright did a great session yesterday with colleagues on the H5N1, which the US is doing a fantastic job, not Rick, no, sorry. On try to control, because again, it's one of the unexpected things, Until a few months ago, we didn't have a cow in the cycle of avian influenza. We have birds, wild birds, we had domesticated birds, and we have pigs, and we have humans, can you see how unexpected? Now you have sea lions, we have cats, we have dogs, we have cows. Yeah. So unfortunately, that's what is happening. A lot of unexpected things is happening at the moment, and a lot, associated with climate change. Yeah.
So to follow on from that, and will be a question to both of you as well, and this might be a slightly journalistic question, but I wonder whether it is actually true to say that all of these things are happening more, or and is it because we have more people and more tools and more brainy, intelligent people studying these things? So what I'm asking really is it really happening more? Is it really accelerating? Or are we just seeing it more because we're looking more closely with better detection tools and more analytics?
I think, explain to her how many arbovirus outbreaks we had in Brazil in the last 10 years. Yeah.
No, I think, yes, it's increasing. This is a question, For example, the climate world, the climate experts, they are discussing one point now that are in their agenda, that is the climate attribution. How much the change are effectively attributed to climate change. Because there is all the studies on climate and health. This is coming from the 19th century. All the researchers in the 19th century start to think that climate was an important effect on health. But how much climate change is now happening, and how much this influence the disease occurrence. This is an area that is now called the climate attribution, that is growing area of research and inquiry, And there is a lot of evidence, that the events, climate events, temperature, a lot of climate determinants of health events are growing, and become more common, more frequent, and this is affected health. But is yet an area of inquiry, any research, put that, forward, need to think about, how much this is really climate or climate change process, then this, I think, is an important question, to be debated, that what is really related with the climate change process.
And of course, climate change or a warming planet, makes all sorts of animals and people behave in all sorts of different ways. We react as well, and then that'll change the behaviour, and our interactions with different animals makes a big difference.
Yes.
Right?
So just to add that there is two areas that sometimes people don't realize the climate change. For example, climate change and destruction of the environment. We are having the biggest wildfires that we ever had in Canada, in California. In Pantanal, can we believe wildfire in the wetland in Amazon? This is disturbing a lot of the environment. Another area that people don't realize is what we call climate migrants. Today, I think in 2 hours, we're going to have a paper published, a big review paper in Nature Climate Change with some colleagues from Oxford, part of the Climade network, that just highlighting the effect of climate migrants. When a population loses the harvest, which is getting normal, where they go? They have to move to a peri-urban area, normally with the animals, to live in terrible conditions, and in conditions that animals much closer contact with people. They are not in a farm now. So we also have to highlight the extreme climate events and also the undiagnosed problem of climate migrants. And one thing that we know is that it will keep happening, but that doesn't matter where an outbreak happens. The power of these pathogens to spread around the world is very high with great mobility.
For example, in Brazil this year, dengue occurred, outbreaks of dengue, but this year was a bit before in terms of the classical curves. And one of the reasons that was raised, and there is some evidence for that, that's the rise in temperature that is occurring in the great part of the Brazilian territory, and this dislocate the period of dengue occurrence for a period that was not so common to have outbreaks.
Yeah. So I wondered whether I could talk to you a little bit about chikungunya, actually. One of the studies that you recently published in the Lancet was looking at, it was from, your big project is the 100 million Brazilian cohort, which is this vast database, which is a very rich source of information if you can look at it and extract from it what's happening. And you published a study in the Lancet that noted that the risk of death after chikungunya seemed to be increasing in frequency due to climate change and urbanization and heightened human responses to those things. How important or rich do you think that population level health data is, and how can it help us tackle things like chikungunya?
Well, first, the amount of health data is increasing all the world. The amount of clinics, of people accessing health system, then there is a proliferation of data that is growing fast in the world. The quality of this data is also improving. The diagnosis, the training is improving, and then the quality of this data is improving. And then there is now a lot of register, that register moment of this process. When someone is born, there is a registration. When die, there is a registration. If you go to a clinic, there is a registration. Then what you have developing and try to stimulate in our center is to connect this data and link health and social data, and in a unique system that you call I structure the 100 million Brazilian cohort, and also the CDAX birth cohort. The Brazilian 100 million cohort, in fact, now have 130 million people. Wow. And the birth cohort have 28 million births. But it's growing, because it's a dynamic cohort. And then with this, you can amplify phenomena and see in details phenomena that are not seen there is a lot of objectives, but one is amplify phenomena that are possible not to see directly in the clinical environment. For example, the chikungunya paper that you're talking about was a study to see how chikungunya affected death after there is an acute episode, but there is an increased risk of death, up to 3 months after the episode, the original episode. And then you see very significant increase, on stroke, on diabetes death, on cardiovascular death, because the different causes of death that are affected by the virus, and it's possible you see how damaged this infection are. Out of the acute moment where you treat it, you have a lot of needs, but you have other effects. In particular, in patients that already have other pathologies. You saw that very clear in COVID. But it's not so clear in other diseases that are not so frequent. COVID.
They're slightly rarer.
Was a lot associated, with hypertension risks and the other risks. And in chikungunya, there is this effect, and this effect go beyond the acute stage. They go at least 3 months later, and it's only possible to see if you assemble a lot of data, and link this data to connect, and then investigate with proper methods, and proper resources.
Yeah, thank you. I've actually also got a question from the audience on chikungunya in Africa, which I'm going to put to you. The question is from Olivier Valneva. Oh, no, not from Olivier Valneva, from Olivier, who is at Valneva. Chikungunya seems significantly underreported in Africa. What can be done to improve the data and the understanding of these outbreaks, and, for example, to differentiate it from dengue?
Okay. So, yeah, I don't know if my colleague and friend Amadou Sow is here on the, he was in the conference. So, for example, we just worked with the Institute Pasteur in Dakar, yeah, to describe a new big outbreak of chikungunya, but quite surprising, yeah, from what we call the West African clade. The West African clade, it is normally only living the sylvatic cycle. This means that do not cause population outbreaks. And large mutations, a new clade emerge, yeah, and start spreading in Ketagu, that's west of Senegal, yeah, and that highlighted the emergence again of new clades, yeah, and the potential to something live in the sylvatic cycle. This means being restricted to an endemic area, yeah, normally forest area, to move through. So that's something that did worry us, especially because all the vaccines from chikungunya, which is another key priority pathogen of CEP, have been all used with the other clade, which we call the ECSA, the East South Central Africa. So that's something that do worry us in Africa. We also have seen outbreaks of chikungunya in Kenya and in Burkina Faso recently, and that's why we are training large amount of fellows to detect and characterize that in real time.
So that training that you're doing and spreading around the continent will hopefully improve the reporting of chikungunya and that differentiation.
Yes, especially because modern training, yeah, not only we train them, but if they see an outbreak, we will ship them reagents, and my lab team will guide them to characterize in the country. And that's a lot of times that people forget. We need to get post-train support, because if you just train people, send them back to the country with the resources, what they do, they leave. So you think that you are helping a country, but you are really increasing brain drain. They just become better training. And the post support is really important. How to support them when they go back, they can do that. So that this program of Climade is much more than training. It's providing them with the tools and resources to do that in the country. And that will get country buy-in, because the countries get proud that they detected that themselves.
Thank you. We only have a very short time left. I just wanted to ask one more question based on that panel that we had yesterday on H5N1. One big issue there was the huge gap in data analysis between humans and animals. I mean, we saw, there's been a lot of talk about One Health for many years, but the reality is that One Health is still not really in action. There's still this gap. And I and others found that quite alarming. How can your organization or organizations like Climade help to close that gap?
So that's a great example, because with H5N1, yeah, we went to do the 100-day mission, yeah, but the estimation of the outbreak was 3 months before being made public. Yeah, so can you see, if you cannot incorporate it early detection, genomic surveillance, and make public, your 100-day mission, yeah, can double, can triple, yeah. So and that's, again, people have to think about genomics as a tool of the R&D. That's what I was discussing with Petro, not just as a nice surveillance to have, yeah. And that's what we have to do: early signs, characterization, yeah, making data public, and we also have to have. That's what the pandemic treaty is so important. Should we keep punishing countries that detect outbreaks, or should we thank them and support them? So that's what the pandemic accord is so important. Otherwise, we're going to get the opposite. And that's the problem, because especially when it involve also livestock, people will try to hide the information because they have economical damage. So we have to rethink the way, in a way that we support people to detect outbreaks quick, so we can really do our 100-day mission. Otherwise, our 100-day will be 1,000 days.
Well, let's hope not. Right, I'm sorry, we're out of time, but it was very enjoyable and interesting to talk to you both. Thank you very much. Can I invite you to? And I'd like to thank our panel. So thank you.
Thank you.
And of course, we would like to thank Kate. Nosso muito obrigado ao Túlio e ao Maurício, and also to all of you for participating. We are now going to divide into 3 parallel sessions as we did yesterday. Each of the breakout spaces will be exploring one of the 3 themes of the summit. In here, breakout 1, it will be delivering the 100 days mission for vaccines, diagnostics, and therapeutics. In breakout 2, just out the door to your left, it will be enabling equitable access through local and regional research, development, and production. And in breakout 3, again to your left, but a little further down the corridor, the subject matter will be enhancing global disease surveillance.